Greetings and happy Halloween, and thanks again for tuning into my weekly video update. We're concluding October in a much better place than we were at the beginning of the month. This is good news for our families as we prepare for festivities this weekend. Our COVID case rate numbers are looking less scary, but we are nearly in the same place in terms of cases as we were this time last year, even though we now have vaccines and a high vaccination rate as a community. One of the differences between this year and last year, though, is that we are now on the declining side of a slope, and last year this was the beginning of an uptick. We've made progress to reduce our positivity rates, transmission rates, and case rates. I'm not trying to spook you, but I remain concerned that we could be heading for another spike in our numbers as we get into colder weather and as activities and gatherings move inside, similar to last year. This virus continues to mutate. Even with all the improvements we've been able to make, this pandemic is not behind us. This week, Goucher College released a poll of Marylanders that asked recipients when they thought they would be able to return to normal pre-pandemic lives. Almost 75% of residents believe that normal will not return within the next 6 months. This strong majority of Maryland residents understand that we still must remain cautious and careful. This understanding and caution of this virus has helped us do better than most people around the country. We need to keep that up. According to CDC criteria, we've been in moderate transition category since last Thursday. Today, Thursday, October 28th, our indoor mask mandate has been lifted in accordance with the Board of Health requirements. As we lift this mandate, I want to remind people that indoor masking continues to be required in our schools and on public transportation. I also want to remind you that any business or entity that serves the public can still require indoor masking if they wish, and they have the right to refuse entry or service for lack of compliance. I want to encourage you to continue to wear masks in public indoor areas, even if you're vaccinated. Wearing a mask indoors and in large gatherings is still a smart and safe health practice and habit to continue no matter what the regulations say. We are still seeing more than 50 cases per day on some days. These are people who are getting exposed to COVID, which is only from person-to-person contact, and that has been the case from the beginning. COVID is definitely not over, and we shouldn't act as if it is. That will only put more people needlessly at risk. I want to thank everyone for the vigilance and adherence to our guidance that allowed us to get back to moderate levels of transmission. This is an accomplishment that needs to be noted and appreciated. As you can see from the CDC map of counties across a wide swath of our nation, very few are in yellow or moderate transmission like we are, particularly jurisdictions as large and diverse as we are. You won't find them here. In terms of our vaccination rate numbers, over 77% of our total population is fully vaccinated and 85% have at least one dose. 91% of our eligible population, those who are 12 and older, are fully vaccinated, and 99.9% have received one dose. Our 99.9% number may seem hard to believe, but it's accurate. It will of course change when the eligible population changes, and that will be in the next week or so when we begin to include 5 to 11-year-old residents. We're preparing for pediatric vaccination of our 5 to 11-year-old kids now, which could begin as early as next week. Earlier this week, Governor Hogan said the state would be ready to administer the vaccine to kids once approval occurs. The county's HHS department is expecting over 13,000 doses initially in our first shipment, but those will be part of a larger allotment of 40,000 total doses in the county from all sources, including pediatricians, pharmacies, and hospitals and clinics. Many Montgomery County parents are anticipating, planning, and learning about the pediatric vaccine. Other parents may be more hesitant and have questions. We're working with MCPS, our community partners, and health outreach teams to make sure that these vaccines are easily available and that we answer questions and clearly communicate their efficacy and importance. Parents are encouraged to check with their pediatricians and monitor updates from the county on the timing and locations where vaccines will be available. As important as it is to get our children vaccinated, it's equally important to make sure that the booster shots for everybody who's eligible are being given. After a thorough, independent, and transparent review of the process, the FDA and CDC have determined these booster shots are safe and effective. On Monday morning, I got a Moderna booster shot. I originally received the 1 dose of Johnson & Johnson. I've been feeling fine, no side effects. I'm glad to have the extra protection. I encourage everyone who is currently eligible to receive a booster to please go out and get one. We now have the supply and distribution system in place to easily get this shot if you qualify. They are here, they are available, and they are easy to receive. And as was announced last week, you do not have to receive the same vaccine as you originally received. Did you know that there are over 20,000 Montgomery County residents who only earn about 30% of the area median income, somewhere around $30,000? These families are spending a huge chunk of their income on their rent, typically 50 to 60% of their income, and they still have food, transportation, childcare, and medical costs to account for. We can't just ignore these numbers. We need a new and innovative approach. This week, I was happy to join Council members Will Germondo, Gabe Albornoz, and Evan Glass to announce the Montgomery County Guaranteed Income Equity Pilot that will be the first in the state. This pilot will be introduced at the Council and be funded by a special appropriation of about $2 million with additional funding from the Meyer Foundation. It is expected in 2022 and it will provide direct cash payments of $800 a month to 300 selected low-income county households for 24 months. Area university partners will evaluate the program's impact on participating households with anecdotal, qualitative, and quantitative data. I'm very excited to see this pilot program take off, and I'm looking forward to reviewing the results. This legislation is an important part of how we're governing and creating smart policy through an equity lens. This income will help alleviate poverty, provide a form of financial stability, and give people the ability to make their own choices to improve their economic position. The pandemic may have exacerbated challenges that come along with poverty, but even after this pandemic is finally over, these problems will still remain. We must not allow ourselves to govern back to the status quo. We must not forget our most vulnerable residents in all of this. A county's greatness should be measured by how it treats and supports those who need to be uplifted the most. This is the last week for our Director of the Department of Environment, Adam Ortiz, who President Biden has named as EPA Regional Administrator of the Mid-Atlantic states. I want to thank him for his service to Montgomery County over the past 3 years and wish him the best of luck as the first Marylander to serve in this position. This is a victory for the environmental community to have someone like Adam in this position. Under Adam's leadership, we have begun and implemented many environmental successes. More than 2,000 trees have been planted through our Tree Montgomery program, which was a fourfold increase over the past. We passed the first national bill banning the use and sale of No. 6 polystyrene food service products and passed a ban on plastic single-use straws. We've launched the Commercial Food Scraps Recycling Program, started a single-family residential foods recycling collection pilot, and launched Curbside Recycling Purity Program, reducing the contamination in the recycling stream by nearly 50%. Recently, the Department of Environment created a Critters in Crisis list of local at-risk endangered species, stream critters to bring awareness to the water quality in the county streams and the impacts of fertilizer and overdevelopment. Adam has also helped lead our efforts on reducing energy use that is saving us money, engaging residents, and laying the foundation for us to achieve our Climate Action Plan goals of reducing all carbon emissions by 2035. Our commercial building benchmarking has led to the estimated cost savings of more than $3 million for county commercial building owners. Adam succeeded in working with the Council to pass the International Construction Green Building Codes that we had sent over, and this week the Council has begun work on our Building Energy Performance Standards, or BEPS, to implement building and energy improvement performance standards to address climate change. Adam has been a talented director, administrator, mentor, and a friend to many. Adam helped implement an equity lens for all of our environmental work and developed an equity map to assist us in evaluating our processes to address innovation and equity in program delivery and community engagement. And you'll find equity front and center in our climate plan. His appointment is yet another example of the caliber of people we have here working in the county government. Although we will miss his leadership and innovation inside county government, I'm happy that Adam will still be working daily to protect the local environment as our region's EPA administrator. I wanted to note before the end of this month that October is also National Down Syndrome Awareness Month. Down syndrome is a condition in which a person has an extra chromosome. According to the Centers for Disease Control and Prevention, approximately 1 in every 700 babies in the United States is born with Down syndrome, making Down syndrome the most common chromosomal condition. Down syndrome occurs in people of all races and economic levels. People with Down syndrome have an increased risk for certain medical conditions such as congenital heart defects, respiratory and hearing problems, Alzheimer's disease, childhood leukemia, and thyroid conditions. Every person with Down syndrome is a unique individual and may possess these characteristics to different degrees, and some not at all. And many conditions are now treatable, so most people with Down syndrome lead healthy lives. Life expectancy for Down syndrome has increased dramatically in recent decades, from around 25 in 1983 to 60 years today. People with Down syndrome attend school, work, participate in decisions that affect them, have meaningful relationships, vote, and contribute to society in many wonderful ways. As a father of a foster son with Down syndrome, I've witnessed and experienced both his trials and triumphs over his condition every day. He's been part of my life for more than 45 years and has been one of the greatest gifts in my life. To learn more about access to resources for Down syndrome, please contact the National Down Syndrome Society, the leading human rights organization for all individuals with Down syndrome, at www.ndss.org or call 800-221-4602. Again, thank you for joining me and have a great week.